In this video, I'm going to look at a few newspaper articles in the Singapore newspapers in the 1990s and how they talked about cesarean sections. So in this first article, we have from the Straits Times, 2nd of June 1991, cutting water bag or use of drugs can induce birth. What induction means? A full-term pregnancy lasts 40 weeks, but a woman may give birth naturally anytime between the 38th week and the 40th week. The first sign of the onset of labor is when the fetal sac, commonly called the water bag, bursts. The woman then goes into labor, which may last only a few minutes or drag on for several hours. Her womb contracts and the baby is born. So actually, the breaking of the water bag or the bursting of the water bag only occurs about 20% of the time before labor occurs. Most of the time, signs of labor are actually having mild contractions or losing the mucus plug. And I think here the way they say like, oh, how the labor drags on for several hours, definitely sounds like this is not desirable. Induction can lead to normal delivery, but if it fails, the baby may have to be delivered by cesarean section. There may be medical reasons for inducing childbirth. If the mother suffers from high blood pressure or diabetes, the placenta stops functioning. But the risk of induced childbirth are infection, uterine rupture, and other risks of cesarean section. I think now that induction is more common in Singapore, I don't think I've ever even heard of the risk of infection. I think mostly they talk about rupture, but I don't think women are really educated, or rather, they are not counseled by the doctor themselves that induction can cause infection. Lower section cesarean surgery was valued at about US $330, not the US 570 market price. That's very cheap, $300, because now the hospital bill will be about, I think, $2,000 to $3,000, but that includes everything, all the drugs and all the surgical materials and the fees for the doctors and the anesthetists and so on. So we see in this period, like the 90s, because there are more and more cesarean sections happening, then there is more discussion about the price and the costs of the surgery. 1996, let nature take its course in the Straits Times. It is disturbing that more women want cesarean operations or induced labor. The tendency to ask for them appears to be less marked in government or restructured hospitals, where such deliveries are done only for medical reasons than in private practice. Well, here it says that women want these interventions. I think it fails to highlight why women want it. We see that over time, interventions become more common and acceptable from the acceptance of all stakeholders. So while medical professionals themselves promote such technologies and interventions, how are women being educated about these interventions and how do they know about them in order to want them? We saw in a previous video, which I will link here, in the 1980s, there was a lot of public education about what C-sections were. And in that time, we also saw a rise, a doubling of the C-section rate almost every year. Okay, let's read some more. The threat of a lawsuit is said to be a factor influencing a private practitioner's decision to go along with a patient's request. Be that as it may, the reasons for patients requesting specific dates are astounding. Some want their children to be born on auspicious dates or on dates that coincide with parents' wedding anniversaries or their own birthdays. As if this artificially induced coincidence were not enough, some want their babies to be born earlier so as to qualify for tax reliefs for that year. I can add an anecdote to this because my parents did the same thing about me and my siblings being born by cesarean section. So all three of us were born by cesarean section. The first one was in the public hospital because I think the medical indication was that my mother had high blood pressure. And then for second and third births, it was at a private hospital, also cesarean section, because at the time my mother was told that once a C-section, always a C-section. As we saw in previous videos as well, there was this kind of maxim going on, doctors were saying such a thing that it would be best if the woman stopped at 3 as well because of the accumulating risks of each surgery. And I do remember my parents also saying that they wanted us to be born on specific dates. So the oldest of our siblings is born in December, and I was also supposed to be born in December, but then my mother had a fever, so the date was postponed 1 week, and that is why I'm born in January. And our last sibling is also born in December. So my parents definitely tried to play this auspicious date card, and they wanted all of us to be December babies. But I was thinking as well, since my birth was postponed 1 week and my mother still had not gone into labor yet, she could have still been quite early. She could have been 39 weeks, 38 weeks, depending on when they scheduled the cesarean. Needless to say, this is wrong. Okay, let's read some more. Induced labor and cesarean deliveries are not risk-free. The only good reasons for undertaking them are therefore medical. That is to avoid even greater risks to the mother and the child from normal delivery. Other reasons are fanciful and could be harmful. Childbirth is too important a matter to be subject to whims, even those of parents. While doctors must be sensitive to the needs of patients, this does not mean accepting palpably unreasonable demands. They should impress on their patients what the stakes are. If the latter are adamant, particularly on unnecessary cesarean sections, they can remember what a doctor said to a mother with a normal pregnancy who insisted on an operation. He told her that she might want to see another doctor. I guess the unfortunate thing is that even if one doctor refuses, there is another doctor, perhaps in private practice, that is willing to do the C-section as long as the patient pays for it. And that is why we see in this period in the 90s, there's more talk about regulating the private sector because the C-section was becoming more and more commercialized and being done for profit. More women asking for cesareans and induced labor. This was in the Straits Times on 5th September 1996. They want birth on auspicious date and they want to qualify for tax relief. Induced labor and cesarean deliveries must be taken seriously because there are risks involved, said doctors at two restructured hospitals. That means public hospitals. Cesareans made up about 19% of deliveries at Kanakabau Hospital last year. That's the biggest public hospital. The 3-year average at the National University Hospital, the second biggest public hospital, was 14%. So this is growing quite fast. We saw in the 80s it was 12% at the end of the 80s, and now this is what is it, 1996, right? It's 19%. Cesareans are usually performed if the baby is very big and the mother has a small pelvis. They're also done if a mother's blood pressure is high or if she has diabetes. Said a professor from NUH Department of ONG, because we are an institution, we get a lot of high-risk cases referred to us for problems like high blood pressure, diabetes, or older mothers going on assisted reproduction programs. Cesarean section is a surgical procedure and there's always the risk of complications arising from anesthesia. The mother could actually die, said Kanakabao's Dr. George, SHO. There is also the risk of infection and bleeding. The risk does not end with the operation. Blood clots may form, and blood circulation is slowed by the enforced bed rest. Sudden death could result from a condition known as pulmonary embolism, a blood clot resulting in the pulmonary artery being blocked. So back then you had enforced bed rest. Now, I think within hours of the surgery, at least in the public hospitals, they put on a automatic compressing belt for your legs, which is kind of doing a kind of massage on your legs so that to reduce the risk of blood clots. In 100,000 deliveries, there may be 5 deaths from pulmonary embolism, 5 times higher than in Britain. The rate was 4.9 per 100,000 at Kanakabau from 92 to 95. Even inducing labor is not without its dangers. Prof. Arul said women opting for induced labor have a higher chance of needing a cesarean birth because sometimes the womb may not be ready. I find it interesting that they keep saying women opting for induced labor because now, at least in the 2000s, we know that the largest maternity hospital, KK, has a policy that all women who reach 40 weeks will be induced on that day, the day of their estimated due date or EDD itself. And in private practice, in my research, I have also found that as early as 37 weeks, doctors in private practice are offering induction to their patients. So do women really opt for this, or is it an option that has been offered to them and then they like it could be an option that is offered with certain benefits and then they choose it, they opt for it based on these benefits, right? Like this article says the benefits were auspicious dates and tax relief. 10 gynecologists and obstetricians in private practice said that patients sometimes ask for specific dates because they want their children to be born on auspicious dates or horoscopes, or to coincide with parents' wedding anniversaries or their own birthdays. Otherwise, tax relief. In a cesarean operation, doctors cut through the abdomen and the uterus to take the baby out. In an induced birth, the mother is given drugs to bring on labor. So here we still see a sort of public education occurring in the newspapers. Like, what is the difference between induction and what is a C-section? Dr. George Yeo, head of KK Department of Fetal Medicine, estimated that induced or cesarean deliveries, so this statistics combined, make up about 30% of deliveries performed by private practitioners. So about 1 in 3, but probably a conservative figure, he said. There is no international norm. In the US, the figure is nearly 25%. In Norway, 10%. Netherlands, 6.5%. He told the Straits Times that in government or restructured hospitals, induced or cesarean deliveries are performed only for medical reasons. I wonder why here they combine this figure together. I guess just everything else is spontaneous birth and then this is an intervention. At both the Kandang Kerbau and National University hospitals, for example, there is a regular audit of cesarean and induction procedures. A panel of doctors reviews these cases to see if they are justified on medical grounds. The situation is different with doctors in private practice, said several ONG specialists. Fear of medical lawsuits can influence a doctor's decision to accede to a patient's request, said Dr. Mary Rolfe, who is still practicing, by the way, in Singapore right now. The relationship between doctor and patient is like a personal contract. If anything goes wrong, there is a fear that a patient is likely to give problems in terms of litigation. I think in this period as well, we saw a lot of lawsuits. I believe in my research, I saw in my archival work, I saw there were cases of lawsuits for cerebral palsy, because of a certain section not being done fast enough, or because of a certain intervention that was done during birth, and the parents sued the doctor for cerebral palsy. Even so, I think most of the time the parents did not win. So I don't know how many lawsuits were actually successful. Dr. Mary Ruff, about 15% of her deliveries are by cesarean or induced labor. Whatever the reason, we only perform cesareans on women who need it on medical grounds. This was echoed by another specialist, Dr. Lim Sumin, who said that while he might agree to a request to induce a baby's birth, if the baby is doing well and will not be harmed if the induction is done, cesareans were a different matter. I take a rather firm stand on cesarean sections because of the element of risk, no matter what is said about the advancement of medical science. I recommend it only for mothers who need it. If the mother with a normal pregnancy is insistent, well, then I tell her she might want to see another doctor. The private practitioners interviewed said that they would counsel and educate patients, but they do not always succeed. Again, here it sounds, the way this article is written sounds like, women are really the ones leading the rise in cesarean section. It's because of their desires, making it a very personal, and I think it hints a bit of like women blaming. Added Dr. Cheng Li Chang, once a patient already in labor insisted on a cesarean. I told her she was already on the way to giving birth, but she was adamant. The situation here seems to be that patients are demanding these procedures, not that doctors are encouraging it to make a quick buck. KKH's Dr. Yeo said he did not think doctors would do it purely for money because hospital charges would absorb quite a huge chunk of the cost. Telephone checks with about 10 clinics showed that doctors' charges for cesarean delivery were about $600 more than for a normal delivery. This is mainly because an anesthetist must be in attendance during the delivery. So in the 90s, it could be about 600 more, but now it's about probably 1,500 or 2,000 more. And in private practice, it's easily more than 10,000 more. In 1999, in the Malay newspaper Berita Harian, Ministry of Health is regulating cesarean section. And it talks about this private hospital act. The Ministry of Health is monitoring certain procedures that occur in hospitals. Some changes in laws have been passed in Parliament in order to give the Ministry of Health more freedom to do medical audits. The outcomes of surgeries such as cesareans are being analyzed in order to make sure that the rate is not too high and to avoid the abuse of C-sections. For example, MOH did a study in 1997 about the correct practices towards 12,600 births of babies who were born by C-section. C-sections make up about 27% of 46,000 births last year. So we see in 1998, it has now climbed to 27%. Whereas in the 80s, it was around 12, but doubling every year. Dr. Aline Wong said most of the audits done so far have showed a high percentage in following the best practices of C-section. According to her, if any deviations are found in these practices, the professional bodies or doctors will be told in order to correct their practices. But because C-sections are being done on such a large scale, it's easier if the Ministry of Health can get records, medical records, without having to obtain consent from the patient. However, she assured that some protective steps have been taken in order to prevent the abuse of C-section. Although the private hospital and medical clinic acts have been passed in Parliament in order to give the MOH the permission to obtain medical records without patient consent. This information is only limited for medical audits. To prevent any abuse of this act, there is a maximum fine of $5,000. And last one in 1999, in the new paper, is epidural okay? I had an emergency cesarean section delivery for my first child last year, and I'm now expecting my second child in December. I would like to go for natural delivery, but can epidural be applied? Are there serious implications since the two deliveries are rather closely spaced, about 14 months? If the cesarean section was performed for a recurrent cause, such as a contracted pelvis, then the second delivery should also be by cesarean section. But if it was performed for a non-recurrent cause, such as fetal distress or placenta previa, then your second delivery may be by the natural route. But an emergency cesarean section may be required if things go bad. Most obstetricians allow epidurals for patients with a previous cesarean section. The 14-month interval should pose no danger. Now, at the end of the 90s, because the cesarean section is so high, it's about 30%, almost 30%, we see women now talking about VBAC, or vaginal birth after cesarean, because there is also a movement in the US around this time going back to natural birth, and this also spread over to Singapore. And I think overall, from in the 90s, they seem to talk about women pushing these interventions, but I do believe that some of the cesarean sections being done, in this case, the emergency cesarean section, was being led by the use of technologies such as the cardiotocography, which measures the fetal heart rate, the heart rate of the baby, and any sign of, as mentioned here, fetal distress can lead to an emergency cesarean section. So instead of C-sections being done before birth, meaning just a planned C-section, there's also a number of C-sections that are being done during labor itself because of this created problem of fetal distress, which obviously could not exist before there was such a thing as the CTG machine. So that's it. Like and subscribe if you like this video, and follow for more such media analysis of medical interventions in Singapore. See you in the next video.